Welcome to Healthy Living, your health awareness show on Afro Worldview, the show that keeps you informed with all your health-related matters. My name is Ronald Abaji. Today on the show, we focus on mental health awareness. But first, let's check out what we have in store for you on the show today. We speak to Dr. Marlon McKay on mental health and clinical psychologist on depression. And we finish off the show with an easy-to-do fitness regime. In South Africa, 1 in 3 people will or have a mental illness, yet 80% of people with a mental illness do not get treatment. Dr. McKay unpacks underlying causes of mental health. Dr. McKay, thank you for your time and joining us once again.
Thank you very much. Nice to be here.
We know there's a big campaign around mental health and mental illness. Is there a difference between mental illness and mental health, or is it one and the same thing?
Yeah, I think that we need to make a distinction, because mental, the lack of mental health is obviously leads to mental illness, and there needs to be a balance. Also, I find that the biggest problem is the stigma attached to this word mental health and mental illness. As if there is something wrong with someone, and especially when you start using the referral system that someone needs to see a psychologist or a psychiatrist, that they don't no longer fit into society, that there's something wrong with someone upstairs, they need to see a quack, all these derogatory terms that start coming out, and it's time that we start recognizing that part of being a healthy person is being well mentally, emotionally, psychologically. And mental wellness and mental health forms an intricate part of being well, just as physical well-being is part of being well. And so we need to focus a lot of our health on the mental aspect of that.
Are you finding that in your practice it becomes a key component for you to discuss with your patients? Because more often than not, they come in with physical signs and symptoms, but with intuition and being in touch with them, you unpack that there could be a further mental health concern.
Oh, I cannot agree with that more. I'm finding more and more, and as you rightly say, as you develop that relationship with patient, it becomes easier and easier to address, the common symptoms: abdominal pain, the tension type headaches, the irritable bowel syndromes. And as you find these patients that present with these types of symptoms over and over, psychosomatic type symptoms, and then you say, is everything okay? Are there any issues, anything that are concerned? And it's amazing the amount of patients in whom you can just start making this link between the imbalance in their mental health with physical symptoms. And it's a tragedy in terms of how many patients get treated for physical symptoms when all they need is just a bit of counseling in terms of balancing their lives, or because of underlying anxiety issues, depression, whatever the case is, adjustment issues that are impacting their physical well-being or physical symptoms. And so we tend to miss a lot of these things by focusing just on what the patient is saying versus what they're not saying and presenting with. So there's a great divide between, and doctors we need a lot of assistance in helping our patients make that connection between what they're presenting with versus what they're actually feeling in terms of their mental health.
Now, as a medical practitioner, seeing people that come in with physical conditions, would you diagnose particular mental concerns that you've identified, or refer them to a psychologist and or psychiatrist?
Yes. So I think based on my level of experience and comfort in dealing with them, I make that diagnosis. And for me, it's a multidisciplinary approach. I try and encourage a team approach. So when I make that type of diagnosis, whether it is part of the physical, mental well-being, I always say, look, this is what we have. You have physical symptoms, we need to address that. But your primary problem is either anxiety disorder, adjustment disorder, depression, and there's medication for it, because obviously, it's a biochemical imbalance, whatever. But we cannot rely on medication alone. We need to equip you to deal with this. And so you're going to need cognitive behavioral therapy, you're going to need coping mechanisms, you're going to need psychotherapy. We need to help you to get through this. You need to change the way you think, you need to change the way you need maybe a family therapy, whatever the case is. And so for me, it's an important thing to get everybody on board to help that particular patient to get through it, so that in the event that this thing happens again, they are more equipped to deal with it and not to rely on medication for the rest of their lives, and that they can have and get through this quicker than just a course of medication and whatever the case.
But do you find that people become too reliant on the give me a pill to fix a condition mentality? Because if you have diabetes or you have hypertension and you're on medication, you take a tablet for a physical condition. But you spoke earlier about that stigma, and people haven't correlated the fact that I must still take a tablet because I have a biological or biochemical imbalance. So with that in mind, they end up doing their own thing, sticking to it now, not sticking to it then. But there's a prescribed period of time by which you need to be on the medication, but be conscious of your behavior around these concerns that do creep up again.
So, you know, one of my biggest challenges is sometimes it's not so much about the patient accepting that they need to be on medication. The issue is the patient worrying about their family accepting. Doctor, what is my husband going to think of me? Doctor, what is my church going to think of me? And I always tell patients, you know, please, experiencing an episode of depression or severe anxiety is no reflection on you, it's no reflection on your character or your faith or your lack of faith. It is something that you have gone through, and it is something that it's a brain condition, and it's unfortunate, but it can happen to the best of people. And so this is something that you have to deal with, and this is why the medication is going to help you to get through it. And it doesn't depend on what the other person thinks of you. You know, and this is your battle, and I'm going to help you get through it. And then the other challenge is, please don't take it until you feel better and think you must. It's okay to stop. It's not an antibiotic. So you need to see the process through until you cure. That may take 6 months. It may take 10 months. It may take a year. And see that through. Don't stop until we've both confirmed that you're better, until you've cured, and then we can negotiate on stopping medication, weaning you off, whatever the case is. But you can't wake up one day and say, oh, I feel better, let me try and see if I can get away with it. And that's the important thing for me.
What about these hospitals that deal in particular addictive behaviors or mental health concerns or mental illnesses, whereby you spend periods of time from 10 days to 21 days in them?
Yeah.
Does it actually help?
Oh, absolutely. So again, in my practice, my experience is in patients who come in where they feel completely overwhelmed, where they feel helpless and hopeless, patients who are having a complete breakdown, who are not coping, and especially in patients who are experiencing suicidal ideation, who feel that I'll be better off if I'm no longer here, or the world will be a better place if I'm not here. The pain is just too much. They need to be on like a suicide watch. They need to be removed and placed in a home where they can be properly cared for and nursed back to health. I absolutely believe that those patients need to be placed in a proper care clinic where they can be nursed back. And so I always use them for especially for those cases. And we have very, very good results with that. And whether it's 7 days, 14 days, 21 days, and it works very, very well. And patients buy into that. Their families buy into that, and they tend to do very well, whether it's a rehab situation, but mostly severe depression. Those have experienced some sort of breakdown, and they do very well, and they can be nursed back into society, reintegrated back into the workplace, and they do very well. And I'm proud of those patients who have willingly gone through that and taken that bold step.
Well, I think it's great to know that being a medical practitioner, that many people would assume that you only deal with the physiological side of issues and concerns, is very conscious and aware and experienced in dealing of the mental health issues. And the fact that you are in a collaborative spectrum with a lot of other experts in the field is only going to deem well for the patients. And I hope many other practitioners bring this habit into practice, because it is a plague that is literally going through the country.
No, absolutely. We have to accept that anxiety, depression, mental illness is a part of our everyday lives. It's part of what we're going through. Crime is here, corruption is here. We see it in the news. All the stories, the hijackings, the crime, the break-in. So we hear these horror stories all the time. So we're all exposed to it. And so everyone has a tragedy that we are experiencing on a day-to-day basis. And everybody has a bad story to tell. And mental illness becomes a part of our day-to-day routine. And so we all go through it. And fortunately, we have the means to deal with it when it does happen. And I'm thankful that we have good drugs that can help us, good clinics, and we never have to give up and feel that it's too late or nothing can be done.
On that positive note, Doctor, thank you once again for joining us and sharing your insight.
Thank you very much, Ron. Thank you.
That's insightful information from Dr. Marlon McKay. It's now time to check out what we have in store for you in Health News.
It seems unlikely that mental health and allergies could in any way be linked. A runny nose or itchy skin does not seem to run parallel with mental and emotional challenges. However, a new study has found that people with asthma, eczema, and hay fever have an increased risk of developing a psychiatric disorder. The study draws on previous work and strengthens earlier research. It may also help guide doctors as they treat people with these allergies. As it turns out, research has found that smoking e-cigarettes containing nicotine affects heart health much like regular cigarettes do. In fact, smokers of e-cigarettes experienced the same, if not higher levels of cardiovascular elevation for prolonged periods after smoking the e-cigarette. They found that using e-cigarettes and cigarettes in comparison to nicotine-free e-cigarettes had the same significant impact on vitals, with participants' blood pressure and heart rate being affected. Many women seem to be experiencing hair loss, and this could be due to various reasons. Physical and emotional trauma may cause a person to experience hair loss as the hair growth cycle is impacted. Major surgery and accidents are examples of physical trauma, whilst death of a loved one, robbery and divorce can be regarded as being emotionally traumatic. Hair growth will return to normal as the person fully recovers from their physical trauma or heals from their emotional trauma. In 2015, the World Health Organization ranked South Africa as having one of the highest rates of alcohol-related road deaths in the world. Why do people still risk their lives and the lives of others by drinking and driving? A study published in Experimental and Clinical Psychopharmacology may explain it. Researchers compared the self-evaluation of alcohol recovery with the actual recovery. What they found is that people think they're functioning normally even when they are technically still too drunk to drive, simply because alcohol intoxication affects our reasoning and problem-solving abilities.
After the break, we speak to clinical psychologist Bradley R. Daniels.